Good morning, everyone, and welcome to the next instalment in our series of Facebook Lives. I'm Carol. I'm from the marketing team, and I'm with one of our senior doctors today, Dr. Jane Glazebrook. Hi, Jane. How are you?
I'm really well, thank you, Carol. I'm really excited to tell our new patients what they can expect from starting their journey with us with one of our new patient assessments.
Yeah, absolutely, and that's what we're talking about today, isn't it? And we know that starting anything new can be a bit daunting, so we thought we'd take time today to talk everyone through what happens when you're a new patient with us, how we welcome you and onboard you. There's a couple of appointments that you go through, so that's what we're talking about today. So I think specifically it's new patients, isn't it? Or patients that haven't been with us for over 12 months. So why do we treat those two groups of people slightly differently, Jane?
So we realise with any new patient and any patient that we haven't seen for a long time, we're not going to know a huge number of information that we will really require to start you off on your weight loss journey. So we do a really comprehensive assessment. So we want to be able to start you off on the right foot. We want to be able to provide you with a program that's going to be successful, maintainable, but most importantly is going to be the safest program for you. So we want to information gather as much as we can about you as an individual, both on a medical standpoint, but also a lot about your lifestyle and your current diet. So we do a two-part assessment to decipher what your weight loss requirements are. So we set some weight loss goals with you, we discuss your current diet and lifestyle patterns, we carry out a medical assessment, and in some cases this can be a physical assessment to consider you if prescription medication could be included as part of your weight loss program. So we know that everyone's weight loss journey is different. So we've heard it all, we've seen it all, so it can be quite daunting for patients. And if they're unsure or scared, all of our consulting doctors are experienced and they have a vested interest in medical weight management, so they'll be able to address any queries or concerns you have as well.
Yeah, I think that's a really great point, Jane, isn't it? Our doctors are really our specialists in this area, aren't they? Obviously, most people watching this will be used to going to their GP, and obviously their GPs and all of our doctors are GMC trained, aren't they? But they will have, a great deal of knowledge in this area just through their experience with us and other interests that they have outside of working with us, but in this particular weight loss area. And that's quite a key fact, I think, that we should be communicating.
Yeah, it's quite often in sort of general practice, as you say, your GP is very sort of medical based, and they won't necessarily always take on board a lot of the sort of diet and lifestyle advice that you will need. They only get a 10-minute consultation with you, whereas at our assessment you will get a 30-minute consultation, so we can really delve quite deeply into your diet and lifestyle so that you can get the best advice for you to get to the goals that you want to achieve. As I said, we've all got a vested interest in weight management and we're all passionate about it. So we really want you to do well and achieve your goals, not just for yourself and your how you look and feel in yourself, but also for your health as well. So we've got that lovely balance of the sort of medical background, but also an additional knowledge on other areas that medical doctors, so your GP and other specialists in hospital, won't necessarily have a vested interest in.
Yeah, no, that's a really good point. So yeah, you already mentioned there's a two-stage appointment that our new patients or those that haven't seen us for 12 months go through. So can you tell us a little bit more about what happens at stage one?
So to start with, stage one is you have a short one-to-one pre-consultation assessment with one of our clinicians. So as we're obviously a medical weight loss service, our programs can include prescription medication as part of your weight loss. So our pre-consultation involve an assessment of your medical history. So to see if you'll be suitable for any of the prescription medications included as part of your weight loss program. So the results of those pre-consultations can decipher if a physical weight loss and wellness assessment is required. And this is so we can safely include some of our prescription medication as part of your weight loss journey. So the one-to-one consultation would happen over the phone with one of our consulting clinicians, and then the results of that would decipher what the next stage of that process would be. So if the next stage was a physical consultation, you would be booked in for a physical weight loss and wellness assessment. And these take place, as you well know, Carol, as a number of our assessment centres throughout the UK. They're a physical one-to-one evaluation with one of our experienced assessors. And the assessor will then take the patient's height, their weight, they'll calculate their BMI. They'll also perform some body composition measurements, including an indication of the patient's body fat percentage, and they'll take your blood pressure and perform a physical examination of your cardiovascular system. And this is quite an important part for some of our prescription medications, including phentermine and diethylpropion. So these assessments, these physical assessments, are all done under stringent hygiene standards, so we can keep them COVID-19 secure, and that keeps up both our patient and our wellness assessor safe, which is our priority, obviously. And as our weight loss and wellness assessments are a medical appointment, as per the recent government guidelines, our patients can leave their home for medical reasons, including these medical appointments, and they can travel and be permitted to travel for these medical appointments. So patients shouldn't be discouraged from attending these appointment process, and they should feel that they will be done in a safe way.
Yes, that's right. And then what I think what you call sort of non-intrusive, aren't they? These checks, they are, they're obviously key to what we do, but they're non-intrusive from a patient point of view.
Hi, sorry about that.
That's okay.
The lovely world of tech.
Yes, wonders of working from home, eh?
Yeah.
So thank you, Jane. I think we got up to you covered what happened in part one, but I was just saying that they're non-invasive checks, aren't they? They're all there's none of they're all quite safe checks have done, aren't they, and non-invasive.
Yeah, all non-invasive, and all can be done with full sort of PPE as well for our assessors. So they're more of a physical examination. You won't have to have any blood tests or anything invasive, as you said.
Cool. Okay, so that's sort of the part one, and then that information goes back to our doctors, doesn't it? And that's when part two and that longer 30-minute appointment that you mentioned before goes ahead. So tell us a bit about that, Jane. What might patients expect to happen during that?
Yeah, so as a consulting doctor, this is probably my favourite part of the new patient journey. It's our opportunity as doctors to find out more about the patient as much as possible, really. The more we find out about you as the patient, the more we can help to find the best treatment program that's going to suit your needs, and it's going to help you achieve your goals quicker, really. As I said, everyone's weight loss journey is different, so we'll want to find out why you wish to lose weight. Is it for health reasons? Is it that you wish to feel fitter? Is it that you want to set an example of healthy living for your children? Or is it that you want to look and feel better in yourself? We'll then do a comprehensive analysis of what your current diet and lifestyle is like. So we'll be able to decipher what areas you will need more support in and more assistance throughout your journey. Many patients often feel, because they've done so many different diets before, that they're an expert on dieting and know what works for them. Diets often have a beginning and an end point, and what we want to achieve is something that's going to work for your whole life. We want to be the last diet you'll ever have to do, and that's because we'll be helping to implement habits and lifestyle changes that will be maintainable. So once you lose the weight, you'll be able to maintain that weight loss for the rest of your life. So we'll discuss the physical assessment results, as you said, and we'll use these as a basis to help to set the patient some goals. So we'll encourage them to set several what we call SMART goals, and these are goals that are specific, they're measurable, they're attainable, relevant, and time-bound. So weight loss is probably the most common one that we set, and this goal meets the criteria in the fact that it can be specific. So we can set a specific goal for that patient. So, for example, we can say that we want to achieve a 2-stone weight loss, and this will be close or within their normal BMI. And we can get the patient to measure their progress easily from home by measuring their weight. We can calculate a weight that's going to be attainable or achievable. So for that individual, we can take all of that lifestyle information that we've got, and we can find a weight that we think is going to be appropriate for them. We know that weight loss is going to be beneficial. It's going to help improve their health, and it's going to make them feel better in themselves. So we know it's going to be a relevant goal for them. It's going to be something that they're going to want to achieve, and it's going to be a good goal for them. And we'll also set a time frame on achieving that weight loss goal. So this will help to keep them focused, and will also help to motivate them because they know what goal they want to achieve and when they're expected to achieve it. So other goals that we might set might include things like their eating habits. So they might want to eat more vegetables or eat less processed food. We might have a fitness goal, so something as walking to work every day or doing a HIIT workout 3 times a week. It might be a health-related goal, so something like aiming to reduce their blood pressure or reduce their stress levels or improve their sleep quality. So once we know in terms of their current and diet and lifestyle, so where they are at the moment and where they want to be in terms of the SMART goals that they've set, we as the consulting doctor will be able to then give them the personalised advice on what changes they'll need to make and what support they might need in order to best achieve their goals. So from going from where they are now to where they want to be. So this could include the prescription medication. So the doctor will discuss the various options that will be available to them, given their personal medical history and their weight loss and wellness assessment results. So this will be very different depending on the individual. They'll also outline how the medication works, how to take the medication, what potential side effects the patient might experience, and they'll also tell them how the treatment will be monitored throughout their program. So additional support can also be discussed. So this could include the additional weight loss supplements that we have. It could be group support on our private Facebook group, close monitoring through our Quadio body composition scales, or it could be the expert advice from our dietitian, our movement coach, and our mindset coach. So as you said, a 30-minute comprehensive assessment really does cover everything. We do delve quite deeply into the different areas, and we really want to make sure we know what the patient wants to achieve, where they are now, so that we can give them the advice on what treatment program is going to best suit their needs.
Yes, and like you say, it's we do want this to be the last diet that our patients do, don't we? So it is. We have got the 4 pillars of support, as you said: the doctor, the mindset coach, the dietitian, and the movement coach. That just to try and change people's habits, change their perception, so that they they not only lose the weight, but they know what to do for the future. So because sometimes dieting is one of those things, you're successful for a while, then the weight comes back on, and sometimes even more than it was before, and then you're sort of, then you all have to start all over again, don't you?
Exactly. Just what you said. We don't want this to be something that's a short-term fix, and then they go back to their old habits and the weight comes back on again with that classic yo-yo style. As I said, we are really passionate that we want this to be the last diet that they ever have to do, and that they can just maintain these changes for life. They don't have to go through this horrible situation again and again.
Yeah, brilliant. And and as you said, that second part of the consultation is all done on the phone, isn't it? So again, no need for anyone to leave their house, other than that health, the physical assessment that you mentioned, the stage 1. Everything else is done over the phone. So if you are at work, you can do it at work. If you're at home, you can do it at home from the comfort of your sofa. No need to worry about parking and COVID restrictions and anything. It's a much more convenient service now, isn't it? And then the medication comes through by secure courier to our patients as well, doesn't it? So it's all remote now.
Yeah, so once they've completed their sort of part 2, and they've got all the information and personalised advice to best equip them to make that decision on what treatment programme to start, again, they'll have the opportunity to discuss all the options that are available with our experienced and knowledgeable support team. And once, as you said, they've decided on a treatment programme, their consulting doctor, if prescription medication is part of their programme, will authorise their medication to be dispensed and sent to them via courier. So, as you said, it's quite a nice, seamless, remote process that they don't even necessarily have to leave the house for any of it. For some of the prescription medication, they'll just need that one-off assessment, and then the rest will be done purely over the phone through their remote consultations.
Brilliant. So I think what we're trying to tell people out there watching this is that if you have thought about losing weight, and I think increasingly we're seeing people come to us for health reasons now, aren't we, Jane, that we perhaps haven't seen before. So clearly with the current pandemic, being at a healthy weight is even more important than it has been before. So it's a secure, friendly service. Our doctors are experts in this space, and there's other pillars of support we can give people to get going.
Exactly. And if you're wondering if you'd be suitable for prescription medication as part of your weight loss journey, you can just book a free pre-consultation with one of our experienced consulting physicians, and you'll know exactly what the next stage of your process would be to starting treatment.
Yeah, that's right. And that's a great message, isn't it? That first consultation is absolutely free of charge. So why not give us a call, get booked in, have a chat with us, and see what we can do to help. And currently during January, we've got some offers on our programs as well. So we know sometimes cash is a bit tight in January, so we've got some great offers for people as well. So we'll pop the telephone number below this Facebook Live afterwards, and then if you'd like to chat to one of our friendly staff, just give us a call. So we haven't got any questions, Jane. So I think we've answered all the points. Is there anything else that you wanted to add before we sign off this Facebook Live?
Yeah, I think you've just answered it. There's no time like the present. January's a brilliant time to start. Every day at the Slimming Clinic is a January or a Monday. We've got patients starting their journey every day of the week, Monday through Saturday. We have consultations, so please do get in contact. As Carol said, it's a free consultation to start with, just to find out if you'd be even suitable to have treatment as part of your program. And our doctors are all really approachable, and as I said, there's nothing that daunts us or that we haven't heard or seen before.
Brilliant. Okay, great. Well, thank you very much for your time today, Jane.
No problem. Take care.
Thanks. Bye-bye.